Can a vaccine be rushed without delay to those who need it most? Canada's National Advisory Committee on Immunization advises the government on these really tough decisions. The chair of that committee is Dr. Quach-Thanh. Nice to see you, Doctor. Thanks for making the time.
Good morning.
So there have been lots of good news from Pfizer and Moderna, both saying their vaccines appear to be 95% effective. And on Friday, we heard from the Public Health Agency in front of the Health Committee that Canada's on track to receive an initial 6 million doses by March if the vaccines are approved. Does that timeline match up with what you are hoping, what you are hearing? How quickly might this happen?
Well, we've heard exactly the same thing the government said, because NACI is an external advisory body to the government and doesn't have anything to do with vaccine allocation. So what our role is really, once we know that there's X million of doses, how do we then prioritize so that it is fair and equitable, and also based on burden of illness and vaccine characteristics, to then make sure that Canadians get it in some orderly fashion.
I would note that the head of the vaccine program in the United States this morning is saying that they expect to get vaccines by December 11th. Have you heard anything that fast in terms of what the government is giving you for a timeline?
No, so what we had heard was that the companies would be delivering in the first trimester of 2021. So that's between January and March, not knowing exactly when it's going to be available in Canada, but we at least need to be ready so that when those vaccines come, they can be delivered and used.
Let's talk a little bit about then the next parts, which is really what your role is, getting it where it needs to be. I'm sure you heard this week from various provinces expressing some frustration, I guess, that they weren't getting really clear answers on when they would get what they need. But will vaccines just be sent sort of across the country, or will it be much more targeted to hotspots?
Actually, our role is not to get the vaccines where they need to be. The NACI role is really to prioritize the groups that are going to be vaccinated at first. And then it's between the Public Health Agency of Canada and the provinces and territories to figure out how the rollout is going to happen. We have no say in that, and it's all the logistics is really between the provinces, territories, and the federal government.
But if you're prioritizing a list, which we'll talk about who would get it first, that would not be a regional priority that you would consider. It would just be who needs them.
It's who needs them. So it's the national guidelines. And as you know, health being of provincial and territorial jurisdiction, provinces and territories have the right to then rejig within what we tell them.
Sure.
Because what happens is, let's say we say at the federal level that we want healthcare workers to be vaccinated first. Healthcare workers and frontline workers doesn't necessarily apply the same way in each province. So you really have to look at locally who you want to vaccinate first, because even if you say there's, let's say, 1 million healthcare workers, you still have to start somewhere. And so that refined logistics needs to be local.
When I read your report about sort of how you were preparing this and prioritizing, there is you did some research as well in terms of who will accept the vaccine, who's ready to get it. And I was surprised to see that the number has softened a little bit in terms of Canadians willing to get the vaccine first versus how they felt back in April, for instance. There's been some softening of that support. Why do you think that is, Doctor?
I think people are waiting to see the data, and I think the important thing for us is to be very transparent in what we are going to see. Depending on who answers that survey, if you are not particularly at risk, then you might say, I'm going to wait and I'm going to take a chance of catching COVID. However, as we've just heard the Premier from Manitoba say, if you are in those high-risk groups, then I think you're more likely to take it on. And because we're starting really with the vulnerable populations and those that are at highest risk of catching it through their work, to me, the importance is just to show the data, and I think people will be more comfortable taking it.
At least two of these, the Pfizer and the Moderna, we'll see about the other candidates, require 2 doses. We do not have a national registry for vaccination. How complicated do you think it will be to make sure that people are vaccinated twice?
I think as you say, it adds a challenge to to this issue. I think that most provinces have registries so that they're able to follow up on who gets what, and it's now the time to really be able to use it. I know that at least Quebec has a registry that works pretty decently well, where we're able to see prospectively who needs what dose of vaccine when. Ontario probably has the same, but so not having a national registry is complicated, but at least provincially, people should be able to follow up on this, and Manitoba and Saskatchewan have been amazing on that front.
This morning at the G20 summit, world leaders decided that they would work together to make sure there's a fair distribution of the vaccine around the world, to make sure that developing nations, for instance, are not left out. I know Canadians are concerned about access, although it does look like our government's, try to put as much on the table as possible. How much of a concern is that for you? And how do you sort of make sure there's equitable sharing of this across our country, while Canada is also committed to helping other nations?
Well, so for now, we don't have enough vaccines for all of Canadian, and so we're going to start by vaccinating the most vulnerable. But there are questions that have been raised, and we will have to look at this between NACI and other working groups to see which vaccines would then be distributed elsewhere, depending on the quantity we're going to have. Because I think one of the uncertainty is what happens to the other vaccines in the pipeline. Are they going to be as efficacious and safe as what seems to be with these first two? I think we need to mention that NACI hasn't yet seen the data of the phase 3 trials from Moderna and Pfizer, and hope to see them soon. But let's assume that they're all as efficacious and safe. At one point in time, we will have to say, okay, so we had a contract for that million of doses. It is way too many doses for all of Canada, so we are going to have to just let go of some doses so that other countries can use them. At this point in time, if all of those vaccines come through, we have much more vaccines than we need for the Canadian population. What
is the biggest challenge right now, Doctor? I mean, there's a lot of hope, I guess, for the vaccine. I don't know if that's a challenge for you or not, but what is the biggest challenge?
To me, the challenge is out of NACI and is really, as you said, the distribution. So we make the recommendations, but between that and getting the vaccine into people's arm is going to be quite a challenge. It's a lot of vaccines to give. At least, it's sequenced out so that it's not 70 million doses that come in at once. Sure. But at the same time, given the ultra cold chain that Pfizer is requesting, the cold chain that Moderna is requesting, the fact that we're not going to be able to do mass vaccination campaigns like when we were doing for H1N1, for instance, because then, putting people together increases the risk of spreading COVID. If you want to go in for healthcare workers and then vulnerable population, let's say in long-term care facilities, we need to have a logistics that is going to work. And that really is at the provincial level to try and sort out. But it's an additional challenge that is currently being worked on.
Do you think, Doctor, that the hope that people see with these vaccines, it could possibly get in the way of how they behave right now at a time when we really need people to listen to public health guidelines?
Oh, absolutely, potentially. If people think that by March everybody is going to be out of the woods because we're all going to get vaccinated, that doesn't work. We expect that those non-pharmacological interventions like physical distancing, mask wearing, and the rest of it will likely need to still be in place for another year or so, because we don't expect most of Canadians to have been vaccinated before that time.
Okay, Doctor, thank you. So good of you to make the time. I got lots of good information from you. I appreciate that very much.
Thank you. Have a good day.
You too. That's Dr. Carolyn Quach-Thanh, Chair of the National Advisory Committee on Immunization.